Hello, my name is Bonnie Olson. I'm a clinical psychologist and a professor of family medicine at USC. I'm also the program director for the Geriatric Workforce Enhancement Program, which supports the program that you're now registering to. The program, which we are referring to as the Age-Friendly Student Senior Connections Program, was born out of an outpouring of interest from students like yourselves who have expressed a desire to be helpful in this time of need when our older adults are so isolated in the community as a result of the COVID-19 pandemic. Because of this, older adults are isolated at home and are restricted from accessing the resources that had in the past been what was sustaining them and helping them to remain connected and engaged in a purposeful life. So your involvement in this program is very valuable, and we hope it is also of meaning to you as well. So I'm going to describe for you a little bit about this concept called age-friendly. The GWEP grant, or the Geriatric Resource Enhancement Program, as we refer to it, is GWEP, had been poised to initiate a program throughout the Keck medicine system, the healthcare system, to bring these concepts of age-friendly care throughout the whole system. And just at that moment when we were about to get started, the COVID-19 epidemic got started. Because of that, we had to stop those efforts and shift our attention to more immediate needs. However, I wanted to help you understand what that program would have brought to our healthcare system, and hopefully will do so in the future once we are in a less critical moment of time. Age-friendly is a concept that's built on evidence. It was designed by the John A. Hartford Foundation, and it was disseminated across the country through the Institute for Healthcare Improvement and the American Hospital Association. Currently, all GWEP programs across the country, and there are 48 of them, have been starting to initiate these age-friendly programs. The premise of age-friendly is to provide care that is oriented towards older adults in any setting that they present in. So whether that's ambulatory, inpatient, or even in community activities or in city activities, there's an age-friendly initiative across the state, across different communities within the state, and in many other jurisdictions as well. For the healthcare situation, the premise is that we provide care that will lead to better outcomes for our older adults. The ideas and the strategies fall into 4 different categories, which all happen to start with the letter M, and thus they refer to them as the 4 M's. These are called mobility, or the ability to get around in the community or just within your home to avoid falls, and similar activities that will help to keep older adults active and mobile. So the first M is mobility. The second one is mentation, and that refers to problems that might come from disorders such as dementia, delirium, or depression that will have an impact on an older adult's ability to think clearly. The next M refers to medications. And here they're encouraging us to provide care that addresses polypharmacy and unnecessary medications that may have an adverse effect, particularly in older adults. The last M, which is really the basis of all of them, is what is referred to as what matters. And here they're talking about what matters to the older adult at the moment when we're seeing them, whether that's in a clinic visit or it's out in the community, that we address the needs of the older adult as they occur right in the moment. It also refers to things like advanced care planning or anticipating care needs that will present themselves in the future, perhaps at end of life and those difficult decision-making points when healthcare providers need to understand what really matters to that older adult, and they may not be able to express that themselves at that time. In the context of this program that you are now registering for and getting some training around, the idea of what matters will be discussed as a topic that you might want to discuss with your older adult partner when you meet together by telephone or whatever platform you end up finding is most useful. The idea of what matters in this context might focus on what are their values and preferences, what kinds of things they're doing now, what activities they're engaged in now that they're isolated in their home, not able to go out and be with friends and family and socialize as they did in the past. So finding strategies and helping older adults to address this now in this constrained environment is going to be really important to them. So we encourage you to find ways to talk about these subjects with your older adult partner. Now I wanted to talk just a little bit about what the commitments are that we would like to ask from you as a student participant in this program. We ask that once you're paired with your older adult, that you make connection with them through the telephone, and we'll provide the number. We ask that you reach out to them once a day for the next 6 weeks. That can be on Monday through Friday basis. If you find that you have a lot of things to talk about and you want to do that over the weekend as well, you can always do more. But we do ask that at least Monday through Friday, you spend 30 minutes with them in some kind of contact. If the telephone ends up being the best route, that's fine. If you find that you're able to help your older adult get on FaceTime or a Zoom platform or some other mechanism to meet where you have a visual or video feed, that's fine too. You two can work together to find out what's going to work best for you two. In addition, we're going to arrange that every day there's a faculty member who's available on call for emergencies. At least some subject comes up that leaves you uncomfortable or that you'd like some real immediate direction around. Someone will be available, and that will be listed on the website that you'll have access to so that you can find that individual, identify their phone number, and give them a call or a text message and get some direction immediately. The other thing we're going to ask you do is to sign up for a debrief session, which would occur once a week at the same time each week for 6 weeks while this program unfolds with a faculty member. We're hoping that those groups are interprofessional so that you'll be meeting together with other students, perhaps from other disciplines, and you can share perspectives on how this is working for each of you. I think that's it from my end. There will be additional trainings that follow this presentation. I encourage you to recognize that you'll get out of this program what you put into it, and that I hope you have a really positive experience with your older adult, and that it is an experience that also helps you in your clinical or other endeavors as you go forth in your professional careers. So thank you very much. Your participation is truly meaningful and it is really appreciated. So thank you. Hello. In this segment, I want to talk a little bit about what the do's and don'ts of your conversation with the older adult might look like. We do want you to talk about what matters to the older adult. Here are some key questions that might help you in structuring those conversations. You might ask, what's important to you? What brings you joy? What gives you happiness? What makes life worth living? What do you worry about? Perhaps, what are some of your goals that you'd like to achieve in the next couple of months, or what you hope tomorrow would bring? What would make tomorrow a really good day for you? What else the older adult might want you to know about them? about their history or the life that they've led. You might also ask them about prior experiences that bring them to this current crisis and situation with resiliency and adaptation. These are going to be important questions to ask. We encourage you to listen closely, ask clarifying questions when appropriate, and really try to communicate to the older adult that you're interested in getting to know who they are and what matters to them. Some other topics you might discuss with the older adult are issues related to technology. With the isolation that comes from the current situation, we become more and more dependent on technology to keep us connected. Sometimes this creates challenges for older adults who may not have the experiences going into this that would help that to be successful. That's where you can perhaps offer some guidelines and some help in getting them set up on things like Zoom or FaceTime or any of the other mechanisms for connecting with people remotely. You can also offer a host of community resources that are available to you and listed in our website. Take a good look at those and get yourself familiar with them so that if your older adult brings up issues that they need some help or resources that are available in the community, you'll be able to quickly seek those out and provide those to the seniors so that they're able to access the needs to meet their needs. If an older adult brings up some specific medical concerns to you, we are highly encouraging you not to provide any medical advice. That might be tempting at times, and you may feel like, I know that there's some things that I can offer here that would be useful, but we're really asking you to inhibit that impulse and instead encourage the older adult to contact their primary care physician and request either a remote or a telehealth session so that they're able to connect with their primary care provider in a safe way without increasing their potential exposure to this pathogen. So in summary, try and be prepared before you get on the phone with your partner and have some questions prepared so that you can stimulate the conversation and listen closely. I hope it's an enjoyable conversation.
Hello, my name is Eden Ruiz Lopez, and I'm the Assistant Deputy Director of the National Center on Elder Abuse, which is a federally funded resource center that's administered by the Administration for Community Living. Also, one of my roles in the Department of Family Medicine at the Keck School of Medicine is that I serve as an elder abuse educator under the Geriatric Healthcare Collective. As students and emerging professionals that will interface with older people on a variety of levels, we really need your help to be extra sets of eyes and ears. Within this 5-minute mini module, I hope that you'll gather why you should be involved. You'll come away with an understanding of the types of elder abuse that exist, and you'll learn how you can play a part in preventing elder abuse in our communities. Why should you be involved? Elder abuse is vastly underdetected and underreported. Our best estimates are that 1 in 10 people over the age of 65 are abused, neglected, or exploited each year. Here's just a snapshot. We know that for every 1 case that's getting to the attention of authorities or investigatory arms, that there are between 23 to 24 cases that are not reported. So we can only expect with a new decade in front of us that these types of cases will continue to surge as our nation's older population continues to grow. So who's at risk? Elder abuse does not discriminate. It impacts people regardless of their ethnicity or their gender. It most often impacts people in their later 70s, and 2/3 of the victims are female. Also, people with dementia or Alzheimer's disease are twice as likely to experience some type of abuse. So let's review the different types of elder abuse. That will be helpful information for you to know. The following types of abuse are commonly accepted as the major categories, but I also would like to point out that sometimes there may be a chance that an older person may be experiencing one or more forms of abuse at the same time. Physical abuse is the use of force to threaten or physically injure an older person. Psychological or emotional abuse consists of verbal attacks, threats, rejection, isolation, or belittling acts that cause or could cause mental anguish, pain, or distress to an older person. Financial abuse constitutes theft, fraud, misuse or neglect of authority, and use of perhaps undue influence as a lever to gain control over an older person's money or their property. Sexual abuse is sexual contact that's forced, tricked, threatened, or otherwise coerced upon an older person, including anyone who's unable to grant consent. Finally, neglect is the failure or refusal to provide for an older person's safety or their physical or emotional needs. Let's talk next about reporting abuse. If you come across a suspicious situation, trust your instincts. Remember that it is not up to you to prove that abuse is occurring. It's up to professionals to investigate allegations of abuse. Making a report in instances of suspected abuse or neglect is the right thing to do, and it's easy. You contact a combination of the following resources, like Adult Protective Services for people residing in the community, or the Long-Term Care Ombudsman, who oversee residents in long-term care facilities. So you would get in contact with either of those agencies within your area, and then you'd also contact law enforcement. You cannot expect that law enforcement will be receiving the information from Adult Protective Services or Long-Term Care Ombudsman, or actually vice versa. We all have the power of preventing elder abuse from occurring in the first place. This is our reminder and continuous homework to not only listen, but to remain alert, share information and resources, and ensure that we remain connected so that there isn't any risk of being left alone or isolated. It's up to all of us. We all have a duty to know the signs of elder abuse and report those suspicions. Our loved ones and the people that we're advocating for deserve that sort of respect and assistance. So here's a list of our websites, and our websites really have a multitude of information, from statistics to frequently asked questions and free online training tools. And please consider, if you have the ability to print out our fact sheets listed on the NCEA website under the publications database. And finally, here is my contact information and our agency's contact information if you need some technical guidance. Please don't hesitate to reach out to us. And thank you so much for joining me today.
My name is Dawn Jostin Hagee. I'm a clinical associate professor at the Suzanne Dwork School of Social Work, and I'm also a faculty facilitator for the interprofessional geriatric curriculum program that we have here at USC. I'm going to be sharing some of the warning signs of suicide risk of older adults during this COVID-19 pandemic, what to say and what to do. Suicidal thoughts in older adults may be linked to several important risk factors and warning signs. For example, loss of interest in things or activities that are usually found enjoyable, and especially in light of the COVID-19, where there's a lot of social distancing and older adults aren't able to go out and do a lot of the activities that they previously enjoyed doing. Cutting back on social interaction. And we know with older adults, the social isolation has increased as a result of COVID-19. Breaking medical regimens also. So going off of diets, not changing their dietary habits, their prescriptions, not taking their medications. Experiencing or expecting a significant personal loss, such as a spouse. Feeling hopeless and or worthless. Talking about feeling hopeless or having no reason to live, talking about wanting to die. Some other signs include putting affairs in order, giving things away, or making changes in wills. Obtaining means for lethal means, medications, or stockpiling medications, or other types of lethal means. Other clues are a preoccupation with death or a lack of concern about personal safety. The older adult might make remarks such as, "This is the last time that you'll see me," or they might make verbal suicide threats, such as "you'd be better off without me," or "maybe I won't be around." They may also talk about feeling like they're a burden to others as well. And the most significant indicator is an expression of suicidal intent that you need to be aware of. Suicidal thoughts are often a symptom of depression and should always be taken seriously. Passive suicidal thoughts include thoughts of being better off dead. They are definitely a sign of significant distress and should definitely be addressed. In contrast, active suicidal thoughts include thoughts of taking action towards hurting or killing oneself. An example of an active suicidal thought would be answering yes to the question, "In the last 2 weeks, have you had any thoughts of hurting or killing yourself?" These thoughts require immediate clinical assessment and intervention by a mental health professional. If the older adult expresses passive or active suicidal thoughts or has described a plan with intent to act, it's essential that you intervene and get help from a mental health professional immediately. So, what can you say and do? First, it's important to convey to them that you really do genuinely care about their well being. If they're alone, you can ask them if they have a friend or a family member who can come and be with them to ensure their safety. What's really critical is a timely and appropriate intervention. Timely and appropriate interventions can prevent suicide. And addressing these issues sooner rather than later often results in better treatment outcomes. You can also provide them with the phone number for the National Suicide Prevention Line, 1-800-273-8255, and the LA County Access Hotline for Mental Health, 1-800-854-7771. Access operates 24 hours a day, 7 days a week, and serves as a point of entry for mental health services in LA County. Also, be sure to contact the faculty on call to address any urgent questions. Additional resources are also listed on the resource page for LA County.
Greetings, friends and future colleagues. I'm Teresa Sivers Teixeira. I'm a PA and practice geriatrics in the Department of Family Medicine. I hope that you're all hanging in there, staying well in these strange and perilous times. Thank you for joining us on this project. And my hope is that this experience acts as some antidote to the social isolation that both you and your older adult partner are experiencing. I want to take a few moments to remind you of some key person-centered communication skills. I've drawn from several resources on active listening and narrative medicine, and I'll make sure that these resources are available for you to check out on our project website. I think one of the most important things to remember as you start this project is that we human beings are storytellers. That's how we make sense of our world, and our stories align with our values and beliefs. Becoming a skilled healthcare professional means learning how to listen and interpret these stories and ultimately relate them to the therapeutic work that you're doing with your client or patient. In this project, you'll be witnessing and facilitating the telling of your partner's story about this challenging time. And it's in this way that you'll learn about what matters to them. Becoming competent at discerning what matters to your conversation partner means that you have to recognize, absorb, understand, and reflect on your shared narrative in these daily conversations. You may find it helpful to write a brief daily reflection of your conversation and review it before the next day's work. You're developing a relationship, and like all good relationships, it's bi-directional. And so sometimes as part of an empathetic response, you're going to want to reflect and share appropriately from your own experience in these times, and that's fine. But remember, most of the talking should be done by your older adult partner. Hey, this is a good opportunity to practice all the active listening skills that you've learned as part of your training. I'm just going to highlight a few, but if you need a refresher, I found a few good resources and fast facts that I will also have posted on our project website. A quick note about working with older adults. sometimes communication really can be hindered by the normal aging process. Sensory loss, a decline in memory, and slower processing of information all mean that you may need to make adjustments to create a comfortable and effective conversational environment. You'll want to speak slowly, clearly, and loudly, and often using shorter sentences is best. Ask if your partner can hear and understand you without straining. If not, make adjustments. And this is obvious, probably, but be sure to minimize visual and auditory background stimulus or distractions because all of that makes it harder for the older adult to concentrate on the conversation. I suggest that you plan some open-ended questions and write them down ahead of time. And you may not get to them all and they may not all be appropriate to the conversation, but if you have them written down, you can really focus in on listening to what your older adult partner is saying and not thinking about your next question. Remember to listen for ideas and emotions, not only the words. And if using a video platform, be attentive to the nonverbal cues and the communication that you observe. You want to also listen to what's not being said. It's often at least as important as what's being said. Be patient. A little silence is fine. Give your partner time to reflect on the question and answer it. Don't interrupt. And if you do, just apologize and try to do better next time. Be prepared to rephrase your question if it seems like your older adult partner didn't answer it. You may want to review a few tips or a few phrases to have in your pocket for probing questions or clarifying questions. And it's always good to ask reflective questions where you reflect back what you understood the older adult to say, so you make sure that you're understanding. If not, you can rephrase the question and ask again. But most of all, the really important thing is to be a kind and empathetic listener, because we're all in this together and our lives really are in each other's hands. Thank you for doing this work, and be well.
Hi, I'm Lauren Fox McMillan. I'm a clinical geropsychologist. I'm also a clinical assistant professor in the Department of Family Medicine. I expect most of the students will be familiar with the concept of mindfulness, and maybe even you've experimented with meditation or you're a regular meditator, but perhaps many of the seniors are not yet familiar with mindfulness or its benefits. Mindfulness really has two parts. It's defined as a mental state achieved by focusing one's conscious awareness or attention on the present moment, right now, while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations, whatever they may be. When our attention is pulled into the past, we might call that reflecting, reminiscing, or perhaps ruminating. And when our attention is toward the future, our minds might be planning, anticipating, or worrying. Ruminating and worrying are types of thinking known to contribute to feelings of depression and anxiety. Now, for the second part of the definition of mindfulness, when we are mindful, we accept our experiences with gentle curiosity, not with judgment of good or bad, desirable or undesirable. We simply accept them as they are. So, how do we become more mindful? It's through practicing meditation. Meditation is a secular exercise for your mind, and really anyone can do it. There are many different teachings about meditation. Some of them use a focus point outside ourselves, like a mandala or a candle or a chant. These are relaxing and helpful, but the most effective technique is to use our own breath as the focus point to return to again and again. It's something that's always within us and always moving and changing. Now, ample research has shown the benefits of meditation practice. They are broad, including reducing stress, managing depression and anxiety, anger, and even chronic pain. Meditation also enhances cognition and memory, helps with emotion regulation. increases relationship satisfaction and fosters spiritual well-being. Now, right now, virtually all wellness experts are strongly recommending meditation as one of the most helpful tools to help cope with these COVID-19 restrictions and worries. If I've piqued your curiosity, you can check out the guided meditation resources available at Mindful USC. They'll walk you through how to try these different things, and there are different meditations for different situations. There are some wonderful apps out there too, like Calm and Headspace, but unlike those, the content on Mindful USC is totally free to explore. So I encourage you and your partner to pick one of these meditations, try it out, and then compare notes on how it went. The most benefits do come with daily practice, even just 10 minutes. So the best way to establish a daily practice is to pick something that's already part of your daily routine, say brushing your teeth. Pair the new behavior with your meditation right afterwards. And it's helpful to remind yourself, say it with like a sticky note on your bathroom mirror. Just spend that 10 minutes sitting with your eyes closed in a relatively quiet space. You can use the Mindful USC app. Once you feel confident using it, you don't even have to use the app. Just focus on the physical sensations of your breath as it enters and leaves your body. Notice when your mind wanders. And remember, it will. Our minds are built for thinking after all. Just notice my mind wandered off. Gently let that thought, feeling, or sensation pass into the past and bring your attention back to the sensation of the breath right now. And that's basically what the practice is. Within a month, you'll have a new habit and you'll have enough experience to judge for yourself if it's a habit worth keeping. Check the resource page for links to Mindful USC, and good luck.
Hello, this is Dr. Olson again, and this is the last segment of the training video. When it's concluded, please close the link to the video and you will be directed right back to the Qualitrix survey. There will be an attestation saying that you have completed the training video, and then don't forget to push send, which would be the conclusion of your registration. Within a few days, you'll receive an email with the name and phone number of your senior partner. At that point, you can get started with this work, and we wish you well with it. Don't forget that on the website, there are also a large number of resources that you can use either to help yourself in the work that we're engaging in here, and also to provide resources for your senior partner. In conclusion, I want to thank you for your commitment to the project and your willingness to volunteer your time and effort in helping our older adults in the community weather this crisis with the best resources and support that we can offer. We hope it also gives you an opportunity to learn about the effects of the COVID-19 pandemic on this segment of our population and how you can truly make a difference in the lives of older adults. Thank you very much.